Hello, everyone, and welcome to another episode of Skin of Color Savvy, the art of science of treating patients of color, the official podcast of the Skin of Color Society, produced by HCPLive. I'm Dr. Crystal Aguh. I'm an associate professor of dermatology at Johns Hopkins School of Medicine, and I have a personal interest in the topic that we are going to be discussing today, the science of curls. Curly hair patterns are especially common in patients with skin of color, and they carry unique biological, cultural, and clinical considerations. Joining me today is my colleague, Dr. Loren Krueger. Dr. Krueger, welcome. Please introduce yourself and tell everyone a little bit about yourself.
Hello, everyone. Thank you so much, Dr. Aguh, for having me. It's my pleasure to be here. Loren Krueger, I have an interest in skin of colors as well as hair loss disorders, and I practice in Atlanta, Georgia at Emory. I'm also the residency program director. I work out of the VA and Grady hospitals. And I love to see hair loss patients. I find some of those visits the most gratifying, and I'm really excited to talk about the science of curls today. So thank you so much for having me.
Of course. So, Dr. Krieger, you and I spend a lot of time, I think, offline talking about curly hair and curl patterns. And one of the questions that I get a lot when I give talks is like, why should we care? Like, why should a dermatologist care about curly hair? So I know my answer, but I just want to get a sense of your thoughts. Like, why should we even be talking about this?
Whew, that is a loaded question. I feel like I could give a million reasons, and probably so could you. I think at the meat of that question, though, it just reminds me of the patient interactions that I have on a daily basis. Hair and identity, especially curly hair, is just woven into who our patients are. And when you think about how the impact that something like taking care of curly hair, the challenges, the financial impact, societally, thinking about professionally, curly hair matters. It's can be challenging at times. It can be particularly challenging when you're facing hair loss disorders. And truthfully, I find that many physicians are becoming more comfortable having conversations that talk about things like styling and the intimacy of an identity, but they're not natural conversations for everyone who doesn't have curly hair, which is understandable, right? So just I think it matters because we need to feel more comfortable and empowered to give the right information to our patients because this matters for who they are as individuals.
Yeah, absolutely. I mean, one thing that I try to tell dermatologists, curly hair is prone to breakage, it's fragile, it's dry, and it is at increased risk for medical disease, right? Just like
Mhm.
dry skin. So if you are a dermatologist and someone told you, oh, you don't have to know anything about lotions. If it's not a prescription, you don't need to know, or you don't have to know anything about sunscreens. I think 99% of dermatologists would be like, no, I absolutely have to understand how my patients take care of their skin on a daily basis outside of my practice, because if they don't, it leads to skin disease. And that's what I tell dermatologists about curly hair, right? So if you have patients who have really fragile hair that's gonna break, and you don't know how to talk to them about how to take care of their breakage prone hair, they are going to end up with medical disease. They're going to end
Mhm.
up with traction alopecia, right? They're going to end up with some of these other conditions. And yes, you might have medicines to treat them in the short term, but if these practices don't get better, they get to a point where medical treatments won't even help them, right? Many of our patients are then, will develop a scarring alopecia or are forced to get a hair transplant, things like that. And so I really want people to understand that skincare and hair care go hand in hand. And as dermatologists, like we
Mhm.
cannot leave all that up to estheticians and hairstylists. We have to know it because there is science behind that. So you mentioned though cultural identity. How does that cultural identity play into how you have discussions with your patients about their hair when they're coming to see you for a condition like CCCA? How do you kind of weave that into your talks with them?
It's a great question. And I'll take a step back even because I want to build on what you said is that the art of medicine and treating curly hair especially is that you have to recognize that all diseases that affect hair and the scalp can affect curly haired individuals, right? So knowing that you can have androgenetic alopecia, knowing that you can have something like alopecia areata, but then you have this added layer of, well, if I'm not taking care of the hair properly, I'm having acquired trichorrhexis nodosa, right? I'm having traction alopecia, CCCA. So you have to be competent in recognizing what disease you're facing with as you're facing as a dermatologist. Know that, well, not all central scalp alopecia in Black women is going to be CCCA. There are sometimes AGA. So you have to make that distinction and recognize that those diseases also happen in curly haired individuals. But know when hair styling and hair practices hair care matters. So thinking traction, thinking acquired trichorrhexis nodosa, questionably CCCA, right? What's the evidence there? So I think, to answer your question, you have to be somewhat well versed in one, recognizing the disease, and two, knowing when hair styling matters. So it matters for some diseases more than others, right? And then knowing how it will impact your patient's lifestyle, right? The cost that goes into taking care of curly textured hair is incredible.
Yeah.
The amount of thought and intentionality you have to put in trying different products and thinking about, whether or not this is the right product for you. You have to be able to have those conversations. How often are you washing? What are you using to wash? Are you pre-treating? Are you using protein treatments? All these sensitive conversations that are tied into an individual's identity as well are still ongoing from the dermatologist perspective, and maybe even add another layer to the care and in terms of cultural identity.
Yeah, and I want to break it down for people who may be listening to this and think, "Oh my God, this is already way over my head." I don't even know where to start. You know what? I'm gonna wait till the end of the episode. I'm gonna get Dr. Krieger's information, Dr. Aguh, and I'm just gonna send my patients over there. And it's like, no, it's so much easier than you realize, right? Because if you're a dermatologist and you see eczema, and you are talking a patient through a soak and smear, just know that that's what curly hair patients should be doing for themselves. You should also know that, you may think that your patient knows more about hair care than you do, but they might not know it, right? You
Mhm.
might be in front of a 40-year-old woman who's never washed her own hair. She's only gone to a stylist to do it, right? And now she's struggling with breakage because she's been in extensions for a long time, and you have to teach her how to wash her hair. And just know it is a soak and smear. So when you have dry skin that's prone to eczema, you tell them to wet their skin, and then you want them to trap that water with an emollient on top, right? And
Mhm.
so from a very basic perspective, just starting with the importance of washing on a regular basis once a week is generally where I tell people what I tell people to aim for.
Mhm.
So washing once a week, using a conditioner. So, right. So just like I don't want my eczema patients using Irish Spring, right? I come up with one product at least that is helpful, right? So what's the Dove soap equivalent for the hair, right? So if you're telling patients use Dove soap, it's not drying. Tell them just to use a non-drying shampoo, and tell
Mhm.
them that they have to use a conditioner with every wash, right? So they have to wash with something that's not going to dry out their hair, and then they just need to trap that moisture when they're done. They can trap it with a leave-in conditioner. They can trap it with an oil, like a non-essential oil, or they can trap it with an emollient. They could go old school and put hair grease on their wet hair, right? And so again, this is just 101.
Yeah.
Right? This is just hair care 101. You don't have to be like, oh my God, okay, I'm gonna tell them to do this and that and a protein treatment. Da, da, da. That's fine, right? But for the hair care 101, it is a soak and smear for the hair. And so just replace the word skin with hair, and you're already 50% of the way there. And patients, when they hear you talk about it that way, they're gonna be like, oh, okay, well, I never did that. Oh, I didn't know that there was a difference in shampoos, right? And so you could pick one or two, right? I have a whole list on my website. I know Skin of Color Society has resources. And you can even go to Amazon.com and look at reviews. Okay.
Yeah.
But everything doesn't have to be science. Some of these things just have to be like practical, right?
Yeah.
Find a couple shampoos you like, find a couple conditioners, and tell patients to start there, and they can interchange as needed, because I just am, I'm so here with you as far as the importance of talking our patients through this. Okay, so let's quickly delve into extensions, right? Because I think one thing that we've skipped over is both of you and I are like washing, conditioning, taking care of your hair. What's your approach to talking to patients about curly hairstyles? And you know they're going to use the term protective styles, which is a curse word in my clinic. But I just like to know how you approach that topic with your patients.
First, I'll say I approach it with humility because we have to understand that the style that I'm comfortable wearing may not be the same style that someone else is
Absolutely.
comfortable wearing. And what I'm able to do with my hair is very different than what someone else may be able to do with their hair, given their, everything they have going on in their life. So the first thing is just seeking to understand. So I love to ask, tell me how you normally style your hair. What styles have you worn in the past? What feels good to you? What are some of the, and I don't always ask directly, but what are some of the pros and cons of when you wear it naturally versus when you wear this type of style? And I let patients kind of walk me through their understanding of the different styles and how comfortable they are with different styles as well. So first is just seeking to understand, minimal judgment, right? And then I think, your point about protective styles, I have this continuum in my mind of protecting the hair shaft,
Yes.
perhaps, but putting at risk the follicle and what's happening underneath the scalp. There's kind of like
Yes.
an inverse
Yes,
relationship between
absolutely.
those. Um,
Agreed.
so
And to clarify, just in case, I don't want to get any hate mail, guys. When I say protective styles, a curse word, it's because the name is misleading. I call them styles of convenience, and I think styles of convenience they have a place.
mhm,
They have a place, right? If you're
for
going
sure.
on a trip to Jamaica and you're like, I don't want to think about my hair, I don't want to do my hair. I'm like, cool. I'm that, let's come up with some styles of convenience that are going to do a better job at protecting your hair shaft. If you're suffering from acquired trichorrhexis nodosa, or if you're suffering traction alopecia, one that's going to do a better job protecting your follicle. But I think when people call them protective styles, they trick themselves into thinking they are doing something good for their hair. And it's not good for your hair, but it might be good for your life, right? For your
Yes,
time and things
which
like that,
matters,
which
which matters.
matters, right? When I was pregnant, I told my patients, you're going to see me in some braids around here. Don't say anything, right? Because when I'm in my third trimester and that fourth trimester, like that's really important. And but I love that you're saying, I approach with humility. Tell me, the upside for you. Tell me some of the downsides that you notice. I really think that's super helpful.
And then we do know that certain things put you at higher risk, especially for like traction, right? Traction alopecia. So if you're going to wear a protective style, protective mainly being braids or, twists, or if you have your hair braided underneath, like a sew-in weave, okay, that's fine. Let's talk about how long we keep it in, right? And whether or not we're going to use heat or a chemical immediately after taking it out. So what's our strategy? If you want to keep the style in or the braids in, I like to have it come out within 6 to 8 weeks. Would you agree with that?
I agree
Um,
with that. Yep.
um, I would like to avoid going directly from one braided style to another braided style.
Agreed.
If you're feeling anything like significant pain, the next day you're having a headache, you're seeing pus bumps, you're seeing redness, you're seeing like almost, it looks like your hair is physically being pulled out. And sometimes we see this on exam as the
Absolutely.
dermatologist, right? Then that style was too tight.
Yeah.
Um,
Agreed.
and avoiding also having straight hair when you're using those protective styles. So, for example, using a chemical relaxer with braids, try to avoid that, right? So, we can use tools in our armamentarium like braids, of
Right.
course, but just making sure we're doing it the right way.
Yeah, absolutely. And that's the thing is like, it's really important to figure out what styles work best. One thing that I try to educate my patients on is as we get older, every body part that we have loses resilience. right? So
Mhm.
it's not unusual for me to see patients come in and say, well, I know it's not the weave because I've been getting weave since I was 20 years old, and I've been going to the same person. So I don't know why my hairline looks different. And I tell them, I said, well, you know what else you could do at 20? You could probably eat a full box of pizza and you probably would lose 5 pounds.
Yeah.
Now you eat a slice and you're +7.
Yeah.
Right. And so you can't necessarily do the things that you did when you were younger and get the same results. So I tell patients that it feeling tight is only relevant when you're young, right? When you're young, your hair gets pulled out if it feels really tight, right? When you had your friend in your chemistry class do your hair and you're like, oh, that was a mistake. But when you're older, it doesn't need to feel tight. Those follicles have been weakened over time. And
Mhm.
as you know, sometimes patients will say it doesn't feel tight at all. And we'll use our dermatoscope and we see all this perifollicular erythema and all this perifollicular scaling. And so that's why I caution patients on using the tightness as a proxy for how dangerous it would be. Now, in the spirit of a take home point, I want to just list two of my preferred
Mhm.
styles of convenience.
Yes.
Okay. And not that I'm saying these are what people should go out and do. If I have a patient who doesn't have evidence of traction alopecia, right? And she's looking for a style that's going to protect her hair shaft and minimize dryness, then I like box braids. I
Mhm.
like box
Agreed.
braids that are a little bit thicker, right? Because you're distributing that tension to many hair follicles.
Agreed.
Additionally, with that synthetic hair, it does help trap moisture. And if you moisturize, apply a leave-in spray a few times a week, follow it with a light oil, you can find that when you take down the hair, that braid kind of just slips right out. You are not at risk of acquired trichorrhexis nodosa. So I like box braids, especially in patients who do not have evidence of significant traction alopecia. Now, if I have a patient with a history of traction alopecia and she has no history of dry hair that breaks easily, then I like crochet braids
Mhm.
because crochet braids are lower tension. The issue is they do block the hair from accepting any moisture. And so while you may not notice that your traction alopecia is progressing as rapidly, if you take down your hair and you're getting a lot of breakage when you comb out, then that would be concerning for worsening acquired trichorrhexis nodosa. And so those are the two styles that I'll kind of float if patients come to me and say, Dr. Agu, I'm going on this trip to Jamaica. What do you think I can do? And you brought up a good point at the beginning, Loren, is it will be really important for people to understand that different curl patterns have different risk profiles, right?
Mhm.
So I'm really talking about my patients with the curliest hair types, type 4 curly hair, right? On the L'Oreal scale, 6 to 8. Those are the
Mhm.
patients that I'm really like, okay, let's think about it. Now, I also want people to understand that curly hair is not synonymous with race. So sometimes
Mhm.
I have patients who identify as black, but their hair is really straight, and dermatologists say, well, you can't do braids, you can't do this. And I say, actually, you're pretty low risk. You can do what you want. Then I have Caucasian patients who have really like curly hair and they're having breakage because they're flat ironing their hair 5 times a week like their friends with straight hair. And I have to tell them, actually, your hair is curly. It's at
Mhm.
higher risk of breakage. It's more fragile. You actually can't put heat on it and color it. Right. And so
Yeah,
it's really important to think about resiliency based on curl pattern and know that while race may serve as a proxy for many patients, that is not the case
that
for
is not the
all
case
patients. Right.
for
So
sure.
really look at the curl pattern. Okay,
And
so
I would also, sorry, one thing that I just have to add this is that it comes up quite a bit, just like you mentioned, things you could do when you're younger versus older. That's a conversation I have a lot in the setting of acquired trichorrhexis nodosa in my older patients who are dyeing their hair and flat iron their hair, or
Mhm.
dyeing their hair and chemical relaxing,
Yeah,
their hair. And it's like, well, we might have to make a decision here
pick
because
one.
right now, right now, the hair is not able to take it anymore, whereas before it could. So
Mhm.
it is also important from the dermatologist perspective to be able to distinguish whether you're looking at a loss of hair density from the hair follicle, right? Like the hair falling out, or whether or not you're having hair breakage. That's an important point too, being able to make that distinguish and be able to distinguish as such and communicate that with your patients, because knowing, well, I'm dyeing, I'm flat ironing, that may have something to do with why it's now breaking.
Right. Instead, in some of those patients, you'll talk to them and say, look, you can't go platinum blonde, flat iron 5 times a week. I know you say you're natural, but the platinum blonde says otherwise, right? And you have to really let them know, because sometimes patients come in and they say, I'm being referred by my primary care doctor because they said that there must be something wrong with my blood work, that maybe I have autoimmune disease. And so they're coming to a medical visit, and if you don't know how to talk to them about hair care, they're going
Great
to be subjected to unnecessary tests,
point. Hmm.
unnecessary scalp biopsy, which will not give you any input on their hair care, right? Because that's just going to look at the scalp. It's not going to look at the hair shaft.
Right.
And so again, just really underscoring that point. Now we are out of time, but I do think that was a good place to end, right? I do
Yeah.
think that was a good place to end. Obviously, y'all could tell Dr. Krieger and I, we could talk about this for hours. So feel free to invite us back. We hope that everyone found today's discussion informative and inspiring. If you're interested in learning more about the Skin of Color Society and its impactful work, I encourage you to visit skinofcolorsociety.org. Please don't forget to subscribe to HCPLive's newsletter and follow us on social media to stay up to date on the latest in dermatology and more. We'll be back soon with another episode, so be sure to subscribe to the Skin of Color Savvy on your favorite podcast platform. Until next time, take care and thank you for listening.
Thank you.
Bye.
Bye.